Hi everyone, this is Jacqueline and Emma Claire.
Hello.
Coming to you today in my backyard.
Yes.
Representing National Center for Plastic Surgery. Today, week 3, we are going to talk about all the fun things that we can now dabble into skincare and procedure-wise after you have finished all your cancer treatments.
Exactly.
So we'll start talking about some of the skincare, and as we talk about some of the skincare, we'll kind of touch on some of the treatments that we do with it.
Yeah,
okay,
absolutely.
So the first thing, actually all these are our favorites, so it's going to be hard to.
Yeah.
Alastin. Alastin is a newish company, but what is their claim to fame is the technology called trihex technology. What that means in layman's terms is they play around with high doses of peptides and different peptides. Peptides are probably the closest thing you can get to a retinol without being a retinol, meaning that it stimulates collagen as good as retinol. Yeah. Retinol is derived from a vitamin A. It's one of the tried and true oldest antioxidants, but it's the one thing that is proven to really get down skin deep and stimulate collagen.
I heard a dermatologist one time, Jackie, back over in Europe, she would call peptides a synonym for chemical messengers.
Yes,
like the messenger bags.
Yes.
I thought that was a really great way of describing them, so patients kind of get a more of an idea, a visual of what they do in the skin.
Yeah, and that's really cool. And the one thing, a lot of these products will stimulate collagen to a point, vitamin C's, a bunch of different antioxidants and ingredients. But the one thing that Alastin has been able to do, and just blows us away, being ingredient geeks as I call us, is that they were able to back up their white papers or their data with a punch biopsy. Yeah. No other skincare line has actually taken it that far. So they did a split on the skin and they punch biopsied one area that used the Alastin products, and then one area that didn't use anything. And what they showed in a period of 14 to 20 days, that it stimulated collagen, stimulated elasticity, which is very hard to do.
Yes.
That's our snapback. So that's what we all want. That's what we see happens first with the aging skin, is that things start to fall and the elasticity doesn't necessarily have its nice little snap. As Emma still does in her beautiful 20s.
Yes.
So with that said, they showed that in that short period of time, it was able to stimulate collagen and clear out any of the bad collagen. So that's really important for Emma and I. Yeah. When we go to do a lot of our procedures, we want to know that the skin is cleared out of a lot of the bad stuff, so then we can now play with our procedures and stimulate the new.
Yeah, no matter what, it's just going to give us a really healthy base to work with, whether it's more superficial treatments like peels that we'll get into in a little bit, or more aggressive treatments like laser resurfacing. So it's really a great product. Well, why don't we talk a little bit about a nice complementary treatment that we can do along with the Alastin products. It's one of our Cyton treatments. Cyton is a laser brand, an American laser brand that we have global. It's global actually. Yeah. And one of the treatments that they have on their Jewel system, or the laser system, is called Skin Tight. So Jackie, do you want to go a little bit into kind of the mechanics of what Skin Tight is and how Alastin in the Skin Tight treatment can better affect the skin together?
Sure. So one of the Skin Tight treatment can be done on any areas of the skin. Our probably number one procedure is on the neck. Yeah. It's one of the areas that we have a tendency of noticing, especially with all the Zoom calls and these virtual.
Yeah, we've been getting that a lot lately. In our virtual skin consultations, patients will say to me, the one thing that I'm noticing, not even my face, it's my neck. When I'm moving, I'm animating, I'm just seeing the fine lines or even the banding that's around the neck. So this can treat both of those things.
Correct. And Alastin has a great neck cream, and that's what we link up with our Skin Tight when it comes to the neck treatments. Emma and I are never, working with plastic surgeons, we're never going to replace plastic surgery. But the way our department works is either we buy time until you're maybe ready to take that step, or it's just an alternative. I mean, plastic surgery is not for everybody, and that's okay. And that's why Emma and I are here. So the Skin Tight, how it works on any area of the skin, patients compare it to almost like a hot stone massage. Yeah. It is not uncomfortable at all. Sapphire brick that we take to the skin, And what we do is we heat up the area, we section the area. I'll just focus on the neck for instance. We'll just section out the area and we will heat up that skin to about 40 to 42 degrees Celsius.
It's hot, but what patients need to know, I think, is it's a deep dermal heat.
Yes.
Dermal meaning deep into the skin. We have two main layers of our skin. We have the epidermis and we have the dermis. And the dermis is majority of where, with our treatments and our skincare, that is where we want to hit for an anti-aging factor in the skin.
Correct.
It's where our collagen, our elasticity, like Jakki was saying earlier, all of that lies within the dermis.
So we want to wake that up.
We want to wake it up. We
Yeah.
want to stimulate that collagen elastin, but you can continue how you were explaining about the skin type.
Yeah. So, and going based on what Emma just said, the best way I like to explain aging skin is just lazy. It's
Yeah.
just cell loss communication.
Yep.
So it's our job to do certain modalities and certain ingredients that will wake up those cells, wake up the collagen, get things talking again.
Exactly.
And that's all it is. So that's what the skin tight does.
Yeah.
We heat up the skin. Once we get you to that temperature and we check your temperature with an external thermometer, we then bring it down and then we hold it there for 4 minutes. That's where it feels like that hot stone massage with a light pressure, and then we move on to the adjacent areas. Patients are very happy with the results. It is 5 treatments total, ranging 2 to 4 weeks apart from each other.
Yep.
So we're going to be friends for about 3
A good 2
4
months.
Yeah,
Yeah.
depending on how long it takes you to get into that window. But patients, we really haven't had anything but positive feedback from this.
And once you're done with that initial corrective stage, you can go to kind of quarterly or every 3 to 4 months having a what we consider a top-up treatment, so a once-off skin tight, just to keep making sure that the collagen elasticity is alive
Yes.
and well.
Everything requires everything requires maintenance.
Even plastic surgery.
Everything requires maintenance.
And actually, to go back and touch on that little notion about the plastics that you were saying
I know where
about
you're
a
going.
minute earlier. With plastic surgery, for example, we'll talk about the face and neck. When patients have a neck lift or a facelift, the face will be visibly lifted and you will see a very noticeable, visible difference. However, the chemical compounds in the skin are still the same. So we have not necessarily stimulated any collagen, elasticity in that skin. So although you do get a quick fix
Nip
with
and
the
tuck.
facelift,
Yeah.
a little nip and tuck, which is not ever bad, you will notice gravity is always going to win over time. 5, 10, 15 years after that facelift, the skin quality is still going to decrease. It is still going to be the same as it was even pre-facelift. So that's why it's so important, if you're considering doing something like that, to combine it either with skin tight treatments we can do for the neck, as we've been saying, or even for the lower face to give it a nice lift. We often will pair our skin tight treatments with neck lift or a facelift
And lipo.
for maintenance
Neck
and
lipo,
liposuction.
the big one for neck lipo.
Absolutely, because when the soft fat comes out of the neck, you're left with sometimes, not all the time, but sometimes a little bit of crepiness in the
Looseness, yeah.
neck, some looseness. So we go in and we tighten that up. So lots of options for you.
Protect your investment. If you're going to take the
Yes.
time, the money, everything to have plastic surgery, you want to. Emma and I are here to invest that, to help you invest that, to protect that investment. I'm sorry.
Absolutely.
So do you want to talk about ZO, one of our favorite brightening protocols?
Absolutely. You know this is my favorite product. So ZO, I previously worked with ZO in my last cosmetic doctor office over in Europe, and it is one of my personal favorites out of our skincare repertoire that we have in the office. Today we're going to be highlighting 2 products for you. The first one being our Bright Alive Skin Brightener and our Retinol Skin Brightener 1%. This is the strongest medical grade retinol that you can get on the market, is a 1%. So starting with the Bright Alive. Bright Alive is a non-hydroquinone brightening agent. It is also a natural pigment suppressant. So we have these things called melanocytes, which are in layman's terms pigment cells that live in our skin. And they live in the 5th layer of our epidermis, which is considered still our superficial layering. So that's why hyperpigmentation or pigmentation in general is so very readily seen on the skin. We necessarily don't see collagen or elastin in the skin because it's deep in there. So you're going to be visibly seeing your hyperpigmentation, which means you will visibly be seeing the good results that come from a hyperpigmentation product or a pigment suppressing product. So what we're trying to do in a non-prescription grade way is to just suppress the healthy melanocytes that you are creating in your skin to make sure we can go in with something like a corrective product like the retinol skin brightening agent I'll talk about in a minute to really schleff off, I know that's your favorite word, Jackie.
Schleff it off.
Schleff off all of that dead keratinocyte hyperpigmentation that we have left on our skin, our sun damage. And this is perfect if we are all done with summer, we're going into the fall winter time. This is the time to be pairing a nice brightening protocol if you have dense sun damage from the summer, along with courses of peels. And I think I'll let Jackie touch a little bit on that later. But the second part of our main brightening protocol,
and even to touch on that, you know, with just the average person having issues with hyperpigmentation, we see with just the cancer treatments, chemo does unfortunately bring out a lot of hyperpigmentation in our patients. And it's also because when you go through chemo, you do have a pretty high chance of having some form of skin cancer later on in life.
Yes.
So a lot of that damaged cells and pigmented cells are going to come up to the surface.
And I feel like a lot of people might not know this, but about 90% of all skin cancer, to put it bluntly, is optional because it is solely due to our sun damage. Solar damage. Yeah. That is the reasoning of why you get basal cell carcinoma, squamous cell carcinoma, and some patients with the unfortunate result of melanoma. So this is not only a cosmetic brightening product, but it's also a health product. It's really keeping the health of the skin as healthy as it can be and getting rid of all of that excess sun damage. And the great thing about our past chemo patients that want to go on something like this is majority of that sun damage, Jackie, that's come up on the skin was due to excessive trauma that's been done. So it is more of a superficial sun damage or traumatic damage. So it is a great way, this is a great product to really get that stimulating, get it off. It just means that it's going to take a shorter period of time versus a little bit of deeper sun damage treatments such as melasma.
Yeah, retinols are vitamin A. I mean, vitamins A, C, and E, tried and true, like the oldest antioxidants. And there's, in my opinion, there's still some of the best ingredients out there to play around with. So a lot of times people are scared of retinols. That's where Emma and I come in and we graduate you. We listen to your skin concerns. We know sensitive skin, and we graduate you into the retinols. And not all retinols the same, and I think that's what a lot of people think is they've tried one retinol and they chalk it up as I can't use retinol.
Exactly. Well, a lot of different vitamin A derivatives, and there's different, even in these 3 skincare lines, there's different delivery systems
That's
of
what
retinol.
It all comes down to.
Exactly.
The delivery.
So now that you actually mentioned that, I'm going to put these guys and compare them because this is a great option if for whatever reason your skin is a little bit more on the sensitized side and you want to play it safe and you want to have a retinol that's not necessarily going to give you that controlled reactivity that Jackie's been kind of mentioning. So I'll finish up with the ZO, which is my personal favorite. This is the retinol skin brightener that we usually pair with the Bright Alive. However, we can substitute it for the Skin Better Alpha Ret, which I'll get to a second. The retinol skin brightener is a 1% medical grade retinol. This is a superficial retinol, and by what I mean by that is it's epidermal. It's meant for any freckling, any hyperpigmentation that's on the skin. We talked about it earlier. It's going to be turning over your skin at a faster rate. That is what vitamin A does. It sends chemical messengers down to the collagen elasticity to stimulate. It's doing all of that and more. We consider retinol in general in the skincare industry a jack of all trades. It really will do everything. But in terms of pigmentation and sun damage, what you're going to be seeing a noticeable difference is sometimes a little bit of lightening of that pigment that you see and just lightly schlepping that off. And you can typically see those results within within 2 to 3 months of usage, like a good visible result.
I think of this retinol in our repertoire and all the different retinols we do have in the office. This is like more of our purging retinol.
Exactly.
Wouldn't you say?
It's a purger.
Yes.
It is a purger. So if you have more sensitized skin, we encourage you to have a skin consultation with us just to make sure that's what it is. Make sure it's not another underlying condition. But most patients, I'd say 80 to 85% of patients can get on this and have no problem.
I agree.
With the notion that they will get a little bit of controlled reactivity. What is controlled reactivity? It is redness, some flakiness of the skin, and some overall dryness. So especially going into tightness, so especially going into this fall and winter months, we want to be mindful of that. So to put it in another perspective, another delivery system of retinol, we have our Skin Better Alpha Ret retinol. Do you want to talk a little bit about this one, Jackie? This is your personal favorite.
This is my personal.
I'll let you take it away.
So how this one is different, and going based on what Emma said before, it is all about the delivery system.
Yes.
This particular product uses a retinoid, and a retinoid in nature, the molecule is a little bigger, so what happens is when you're playing around with like retinols and tretinoins, they have to go through a delivery process to get it. All bioconverts to retinoic acid, and I'm sorry this is turning into a science class, but we love talking about this stuff. But why this one is so unique is two reasons: the delivery system and the type of retinoid. It's a retinoid that they're using, and the molecule is bigger, so in nature it does not, as we call it, bombing. It doesn't open up and turn into that retinoic acid until it gets down to the cell. They have developed such a delivery system that it travels and it will not have to go through a conversion process, not leaving you any irritation, and then it will bomb down there at the cell and start to do its job, where this is more of our purger, and this is our builder.
But they both have the same potency, and they both are going to do the same exact thing.
Yes.
So that is the beauty of science.
Yeah.
Really.
And so that's why Emma touched on the most sensitive skin types. We might get started on this retinoid, get their skin used to just playing around with retinols. This is our go-to when a patient says, I can't use retinols, and we said,
and they want to use something
challenge
every
accepted.
Night. Yep. So Jackie, now that we've talked about all of this brightening protocols and treatments for our skin on a daily basis, why don't we talk about some brightening treatments that our breast cancer patients can do in office after their breast cancer journey? And I'd like to start with my favorite, the ZO 3-step peel.
Okay. So 3-step peel is our go-to. Like Emma said, it's more of a moderate. It is something that we use for brightening purposes. So when somebody is on a brightening protocol with us, if it's through hydroquinone, which is more of a prescription route, or it's a non-brightening skincare protocol, the 3-step peel will just really kind of finish everything off. Those, because it's a TCA based peel, which is a pretty strong acid, but it's mixed with a couple different acids, salicylic, lactic, glycolic acid. So synergistically, they all kind of calm each other down.
Yes.
We're big fans of playing around with combination peels, blended peels, instead of just playing with one acid. Because
Jinx.
one acid will really just sometimes leave you some irritation.
Exactly.
So the TCA component in it is awesome for scarring, acne, hyperpigmentation, melasma.
It's our go-to melasma peel.
Yes.
So if someone has super stubborn pigmentation, we usually get you on a stronger ZO protocol for brightening and pigment suppressing, and we'll put you 3 months later, we'll get you, or 8 weeks even, we'll get you on this 3-step peel, and we recommend it every 3 to 4 months to keep your skin up to date.
Yeah.
Well, that's the ZO. We have the ZO moderate depth peels, and then usually for our more superficial to moderate depth peels, we go into the Skin Better range.
Yeah.
And the Skin Better peels are our Alpha Ret peels. So it's using the Alpha Ret technology with the delivery system and stages of the peel to get down into the collagen, the elasticity of the skin, and just give it a very nice brightening component.
Yes.
If I remember correctly, it's a 30% glycolic and lactic acid and citric acid peel. peel.
Correct.
So it is all brightening agents. This is the one-stop shop for your brightening. This is what you want to do on a monthly basis to keep your routine up to date. We recommend a course of 4 for initial correction stage, and then we can go to a more superficial peel after that, or other treatments that we have in the clinic.
Yeah.
But it's just going to give a very nice nourishing brightening effect. You will have some slight peeling, some slight dryness about 2 to 3 days after this peel, up to 7 days after.
I just gave Emma one.
She just gave me one, and my skin is looking phenomenal.
Yes.
And it still looks good even after about 3 weeks, and I'm due for another one, by the way. Just throwing that in there. Anyways, it's a very good monthly peel to do in the clinic, and 30% in the skincare world for acidic content, 30% is a very high number. So we're very happy to have this peel in the office for our patients.
Yeah. So it will be, like Emma said, it will be superficial. It will be on the lighter side, but you will still feel it. You will still see a little schluffing. There's the word.
Schluff.
Little schluffing, and then you'll just see the glowing skin. I mean, it's great for just a boost if you have a special
event coming up.
Yeah, just giving your skin that nice glow.
Exactly. The other thing we should just quickly touch on, Jackie, before we're finished, is our chemotherapy patients that have gone through their full chemotherapy rounds.
Yes.
We typically will tell patients, if they want to start any of these active treatments in office, such as skin tight and our peels, to just wait safely for about 6 months after their last, not their first, their last chemo session. And please get clearance as well from your doctor to make sure that you are safe to have these acids to use on your skin at that time.
Yes, and Emma and I know how to also assess the skin and make sure that, going back to, I feel like every video we're touching on the skin barrier function and making sure that everything is intact, because you never want to go into therapeutic stuff until we know that your skin is strong and ready.
Exactly. Let's just finish off with a couple more products we have on the table.
Okay.
I know you love Skin Better, so I'll let you finish up with your all-time favorite product, Alto, and then we can talk about Even that we put in the Skin Better range, along with the Alpharet we talked about earlier.
Okay. Alto is an antioxidant treatment, hence the word defense serum. So Emma and I like to recommend it to be used in the morning to protect your skin against all the free radical damage and all that environmental gook you're picking up throughout the day. The 19 different antioxidants don't only protect the skin, but it also helps with redness. So we put a lot of our rosacea patients on this. I love linking this with our BBL treatments, another treatment we can kind of touch on, broadband light, which helps with redness if you're just prone to flushing, broken capillaries, rosacea, and then pigment, superficial pigment just from freckling. That's my favorite go-to. Emma does the BBL treatments on me and my skin does beautifully with it. BBL treatments are also used for scar revision. So all these things are treatments now that you can start playing with when you're done with your cancer treatments. So that's, to keep it short and sweet, that's why Alto's my favorite. It's very thin in nature. It's not thick, so it layers very nicely with everything. Yeah. And then to touch on Even acts just kind of like the ZO Bright Alive. They both are botanical-based skin brightening agents, and they are melanin suppressing agents. So they will help keep those melanocytes from freaking out when they feel the trauma from the sun, just from heat. And if you're prone to hyperpigmentation, you for sure want to be on some type of suppressing agent daily to tell your skin to calm down, because naturally the best way to look at pigment, it's a defense. It's your skin trying to defend itself because it feels some sort of trauma. Exactly. So by using these products, you're telling, I always say you're arming your skin. This is your military for your skin. I love that. Yeah. And if you're unsure about what product to go on, we've touched on this many times and time again. Have a skin consultation with us. It's complimentary. It's complimentary. We can do a virtual one or we can do one in-house. If you feel that you see your skin in the mirror and say you have been diagnosed with melasma or you've been diagnosed with a stronger hyperpigmentary disorder,
we might put you on a stronger prescription strength pigment suppressing agent that we don't have here on the table, but we can talk about at a later date at your consultation. So that we do have options for patients such as those in the office. So please give us a call if that is you.
Yeah.
I think that's everything. That's all the fun stuff that we have for our patients.
Yes.
And we do have other treatments and services. You are welcome to go on our website and see all of the treatments and services that we offer at NCPS.
So should we touch on a couple of our favorites?
Yeah, go for it.
Dermaplaning, microdermabrasion. I'm still a big fan of microdermabrasion.
She loves her microderm.
I mean, I still do my old school.
I'm still getting up there. I'm still like,
I still do my old school.
I'm into the
crystals.
lasers.
Yeah, so
I'm a laser gal.
Yeah. Ultherapy, which Emma is our Ulthera specialist. Try to say that 3 times.
I know.
So
microneedling.
Microneedling.
We do microneedling as well. We do microneedling with PRP, which is platelet-rich plasma. We actually draw out your own blood, spin it in our spinner, and take your liquid gold and reapply it to the face as we're microneedling. So we're giving your skin so much natural, literally natural nourishment and hydration, and helping with those fine
your own
lines.
growth factors. I mean, your skin's going to respond to its own growth factors and produce more collagen.
So as you can tell, we have so many fun things to do in the clinic. So just reach on out to our website. We'll put it down here as a link below if you guys want to see it. And if you have any further questions for us, my email is emmaclaire, CLAIRE, .connor@nationalpsurge.com. And Jackie, yours is?
JSweet at national, P as in Paul, surge, SURG.com.
All right, guys, thank you so much for joining us on week 3. And we'll see you for our final week where we're going to have a special surprise week.
Yes.
All right.
Stay tuned.
Stay tuned. See you later, guys.